67.2. PO2 is around 77, yes, 70 plus. But PCO2 is 110. Now in BiPAP setting, what will be your EPAP and BiPAP value practically, so that our main target is washout, not the PAP. In that way, how what should be the setting?
Non-invasive ventilation in COPD is predominantly for carbon dioxide.
Washout.
Okay, it is not mainly for oxygen, because oxygen you can always add. Now, the higher the pressure support, the better is the alveolar ventilation up to a point. And the pressure support in a BiPAP is the difference between the IPAP and the EPAP. So obviously you have to keep this difference sort of reasonably high. Now, there is no formula as to how you should approach this. So it has to depend from patient to patient. Only by checking it, doing an ABG, checking it how it's going. So usually the way I do is maybe start with a very low EPAP 3, maybe a low IPAP 8, because just to make the patient comfortable.
10/4.
Yeah, whatever it is. Yes, absolutely.
Difference.
And then gradually increase the IPAP more than the EPAP.
Yes.
Okay. So maybe keep it at 15.5, 16.6, something like that. So you give an adequate pressure support. And that is the way you kind of wash it. But all patients you will not be able to help with non-invasive ventilation. When we will not have had any problem in this world, we will not need the ventilator. So the whole idea is to give them a reasonable amount of pressure support. And symptomatically, you can see whether the patient is now less listening and more comfortable. Once that is there, you will automatically know that the PCO2 is coming down in these patients. And the emphysema patients do not do well.
Yes.
The so-called pink puffers. It's the so-called blue bloaters who have a high PCO2 who do well in non-invasive
They are more
ventilation. Emphysema patients, once you have PCO2 levels which are high, that is usually a terminal or a pre-terminal event. These patients are not going to do well, whatever you do.
Your opinion regarding the different drug delivery system of these inhalers?
The most crucial aspect of inhaled medications is drug delivery. Now, if you look at the research which is being done in the world now, most of it is on drug delivery rather than on new drugs, because there are not many new drugs. And one is not better than the other. The whole idea is, it's like a buffet. Some patients prefer one particular type, some patients prefer the other. But whatever they are preferring, make sure they do it properly. And that is where the actual, the expertise comes in. And our lack of time is unfortunately the most important reason why we do not do this. Every patient will tell you that they are taking it well. And you ask them to demonstrate in front of you, and you will find that 60 to 70% the technique is bad. Now, if you are using a meter dose inhaler, you should use a spacer. To use a meter dose inhaler without a spacer is not going to be effective, unless it is for just short-acting beta agonists, because even if they take 2 puffs more, it does not matter. But for any maintenance therapy, you need that. Now, dry powder inhalers, the trend all over the world now is to use multi-dose dry powder inhaler systems. So that is why the AccuHaler is a very, very good system. The TurboHaler is also a good system. So you have many good systems. The problem is that obviously some problem is the cost in our country. That is why you have the single dose dry powder system still very popular, because they take less understanding, cheaper, but they are definitely less effective. But it is still better than giving nothing, because there is a problem of humidity, there is a problem of desiccation. So I think the delivery systems are very important. It's very, very important to coach the patient. Please try and check at every outpatient visit whether they are doing it properly. So if you have a system in the OPD where there is a nurse or somebody, paramedical person who can help you and do this, that is the best. Because for doctors, as doctors, we are not very good at operacy, because our mind is focused on more on the therapeutic side than on looking at these logistics. So that is how they actually do it in the West. It's all organized by the nurses or by the paramedics. But to say one system, companies will tell you different things. They will always tell their system is the best and the others are not good. That is more of a marketing thing. But the AccuHalers and all have been around for a very long time, used very extensively. A lot of effort has gone into them. So it is certainly a very, very good system. The only thing is obviously it is a little more expensive for most of our patients in our country unless somebody is paying for them.